we are excited to share some examples of culturally and linguistically competent respite research. So we spent the first half of today learning about how we do that, some best practices, how funders are supporting that, and now we're going to hear some examples from a few different select projects. So it is my great pleasure to help facilitate this. Our first speaker, if you go to the next slide, is going to be a member of our Committee for Advancement of Respite Research, Lauren Parker, who's going to share some of her work. I'm going to also share a little bit about a project I've been involved in, and then we're going to learn more about the ECCHO program from our speaker, Kadijha Marquardt-Davis. So we're very excited for these next couple presentations, and again, encourage you to pop questions and thoughts you have in the chat as we go. So without further ado, I'm going to invite Lauren to share her presentation, and I'll put the spotlight on her.
Okay, thank you. So happy Wednesday. I have to look up sometimes and see what day of the week it is because it's getting darker outside. So time is escaping me. So I'm happy to be here and thank you so much for inviting me to just share how I think about cultural and contextual adaptations of adult day services. So as you mentioned, I'm Lauren Parker. I'm on faculty in the sciences at Johns Hopkins Bloomberg School of Public Health. Next slide, please. So to get us started, if you were to ask me what my favorite respite or home and community-based resource is, I would say Adult Day. I love, love, love Adult Day services. And why do I do that? Adult Day is a great service because it provides care and supervision for older adults during the daytime, and it provides an alternative to nursing homes. So in a lot of the work that I do, a lot of the communities that I work with prefer to keep the person that they're caring for at home for as long as possible due to their cultural preferences. And so because of this, adult day programs are a great alternative because it provides care in a very supervised, formal way to the person who needs assistance. Oftentimes, in the case of my research, I'm really thinking about clients who have Alzheimer's disease and dementia. And it also provides respite to family caregivers. And so these caregivers, as many of you are on the call, it gives them time to just let their hair down, to breathe, or it might give them time to attend to the other responsibilities they have. We know a lot of times in the context of a family caregiver, people who are family caregivers also have other outside obligations. In addition to taking care of someone, they are also working, having to go to a 9 to 5, or having to do other responsibilities outside of their day-to-day with caring. Adult day services that really support caregivers through systematic programming and supports provide education, and they can build skills for caregivers. So a lot of times in adult day programs, there are already existing programs to better leverage the resources that are in the services by connecting them to other resources in the community, and also just being just a great hub for people to come to get additional information to learn how to deal and manage with the person that they're caring for. We know that there can always be improvement in different strategies, and it's so great that organizations like ARCH and the National Adult Day Service Association and other organizations as well are really thinking about strategies and how to really improve caregiving using adult day service clients. Next slide, please. So for me, why is this important? Why Adult Day? I said that it's my favorite home and community-based resource. For me, I'm always thinking about how do we make sure that racial and ethnic minoritized groups in the United States are getting and receiving services to really assist them from a cultural perspective and just make sure that their needs are met. So nationally, there are about over 4,600 adult day service sites, and they serve over or close to 300,000 participants. We know that these numbers kind of did some up and down shifting when COVID happened. COVID had a huge hit on the number of services, adult day programs that were offered. A lot of times these sites were forced to close because they were mandated to close, but then also that struggles with clientele coming back after COVID allowed them to reopen. So this number does fluctuate a little bit, but we know that more and more programs are starting to get back on their feet after COVID, and that's such a great thing to know. Why this is important in terms of a racial and ethnic lens, or thinking about it from an equity lens, is that in the literature, it's largely said that racial and ethnic minoritized groups do not use formal sources for care. Some literature often says that these clients don't use formal sources, but when we look at adult day programs, about 60% of ADS clients identify as a racial and ethnic minority. So that makes adult day services the most heterogeneous community-based service, and that is because these sites are located and reflect the locations of diverse groups. So they reflect the diversity within those groups. Next slide, please. So why is there a need for cultural and contextual adaptation? And I think I froze. Okay. In 2030, we know that their projected estimates say that there will be about 38 million older adults who require some type of support. And these families will be the bulk responsibility and carers for these older adults. And oftentimes these people are doing this without formal services while also managing the other responsibilities I listed early, such as going to work or doing childcare or other outside tasks. And we know that minoritized racial ethnic groups rely strongly on family support. And this has to do with the strong cultural preferences for I'm taking care of my family. This is something that we've done historically. This is my preference. And then also we know historically there have been a lot of structural factors that have limited the accessibility and also the affordability for minoritized racial ethnic groups to utilize formal services. So because of that, we know that a lot of times the current services that are offered might not fit the cultural needs of these groups. Next slide, please. And so when I talk about cultural adaptation, I'm really thinking about how do we modify services that are already currently being offered to really think about the preferences, the unique preferences, their needs, and just the way people prefer to go about activities. So when I think about key components, if I were to have to, I only have a short amount of time and it could be a huge list, but if I were to think about key components of cultural adaptation as it relates to adapting adult day programs, I really think about adapting language and communication. We know that language is a huge thing. How people speak with you, the language, the preferred language that people use to interact with you is so key. And so when thinking about adaptations of these services, really thinking about, is the language that you're using accessible? Are there interpreters on hand if you cannot interact with a client who might need some additional language considerations? And also when developing outreach materials, because a lot of times adult day programs are thinking about how to outreach into encourage more clients to come and to use their services. Are people being critical and thinking about the cultural opportunities or how does a pamphlet look or how we're going about even advertising information about the services, really thinking about it from a cultural lens and making sure that we're inclusive and thinking about community. Another component I think is valuable, and it's a key component of culturally adapting adult day programs, is customizing activities and programs. So tailoring activities to the cultural preferences of community traditions. I have been involved with a number of different studies that have looked at adult day programs. I like to say from Alaska all the way down to Florida. And so when you go to one adult day site, that's one site. Every site is different. But what I have seen a lot of times on sites that really focus on diverse clientele, thinking about music being offered, are we offering things that might be representative of people when they used to live in a different country before they came to the United States? Or are we thinking about different eras? I know some of the sites I go to, dominoes is a huge thing, and playing Motown music might be something that might be representative of some cultures, or ballroom dancing. Those are key things about how to really be really critical and really forward thinking about how to be inclusive in tailoring activities and programming. Also, staff training, ongoing cultural competency training, understanding the cultural practices around caregiving. Oftentimes, caregiving isn't just maybe a one caregiver, it might be a family approach. So then thinking about how do we interact with the entire family when we're offering services or we're trying to interact with the the family caregivers of clients. And then lastly, nutrition and diet, offering culturally relevant meal options. So it might be vegetarian options for some communities who, for religious or other reasons, prefer to have vegetarian meals, or having something might be more rich and more dense, depending on what their cultural preferences are. And all of these things really rely on the administrators of adult day program and those people who are in key leadership roles to really be thoughtful and engaging with cultural adaptations, engaging with the community to make sure these adaptations are possible. So it's an iterative process that goes on from time to time, but it really requires you to really interact and having ongoing conversations with clients and also family caregivers. Next slide, please. So how does cultural adaptation fit within the value of respite model? We know that it's a great model when you think about it from a life course perspective, but it's really important to think about how to make services how to use adaptations to make services more relevant, accessible, and sustainable. Because we know when services are relevant, accessible, and sustainable, that means that more people will continue to engage in these types of services. And so when we make adaptations, culturally or contextual adaptations, it not only supports the caregiver and the family, but it enhances the broader community. And so we can think about how those enhancements can strengthen policy and create more inclusive and effective respite care system. Next slide. So I'm going to go through each of the levels as it relates to the value of respite model. And so thinking about cultural adaptations from an individual level, cultural adaptations directly addresses the beliefs, practices, and needs of caregivers and also recipients. So making those adaptations fit to these cultural groups, it's so important and key, because when caregivers have a sense of ownership or there's some type of reflection in the services that are being offered, they're more likely to engage, and it has more meaning, and it's more they feel like they're more thought of versus it's just something that is being done. It's just a general monolithic service. And we know that when caregivers feel more engaged and they appreciate and they see their values and perspectives and incorporate it into services, we know that this has been so associated with improving emotional and mental health well-being. And this might, in the long run, help them sustain their caregiver roles and reduce their burnout. Next slide, please. When we think about adaptations, we know that adaptations can support strengthening family dynamics. Family structures and caregiving expectations vary widely from culture to culture. We know that it can matter from region to region as it relates to caregiving, but we know cultures have a wide variety as it relates to providing care. And these perspectives can change over time as well. So by adapting respite services to fit these dynamics, caregivers and families can experience less stress and conflict. And this really encourages family cohesion. So I'll give an example of some of the work that I've done in thinking about caregiver support. Oftentimes, caregiver support focuses on one sole caregiver. And some of the research I have in talking with staff members who work at adult day programs, they're like, when it comes to taking care of someone's grandmother or mother, the whole family comes in. And so the whole family wants support, and the whole family needs education about how does a disease trajectory look for people who have dementia, for an example. And so we've really been thoughtful about how to model and change our approaches to think about how can the whole family come in to get something or get a piece of the support program, because we know that that's so important. If one person is involved in a support program and they're trying to take on suggested changes, and then they're going back and trying to make these changes, then the family's like, wait a minute, we don't know about this. Where are you getting this information from? That can cause a lot of conflict within the family. But we see that when families come in and they're learning together about how to have different approaches about how to manage symptoms of people with dementia, we see that it creates more harmony and more balance, because they're coming together to learn something to better appreciate the experience and how to really provide more quality care for the person they're caring for, instead of one person taking it on. So we see that this provides more harmony, more balance within family versus having a one-off support session with one caregiver. Next slide, please. We also know that culturally adapting support programs at adult day service programs increases community level relevance. So when respite services are aligned with community values, this includes culturally tailoring outreach. So sometimes I'll talk to people and they're like, I'm really thinking about how do we adapt our programs, but I don't even know where to start. I was at a conference one time and someone came up to me and said, we have this huge population of Hispanic and Latino caregivers who are growing in our area. And we really want to be thoughtful about how do we adapt our program, but we just don't know where to start. And I said, one, that's good that you can even acknowledge that you don't know where to start. But I think, like I said before, having those initial conversations. So going out into the community and finding trusted people in the community who you can foster relationships with, who can be a leverage or a broker for you to have access to a community to share even the benefits of using supportive programs like adult day programs. Those initial conversations go so far because one, it helps you have a trusted source within the identified community that you want to get into, but then it also helps you, and it can be informative to you about how you think about how you're going about adapting your programs and providing more supportive programs that really fit the cultural need. So this does not only increase respite utilization, but also connects caregivers to community resources. And so by going out and talking to different people in the community, you can find out other support services might be available. So maybe there's, for example, an issue of food insecurity. So going out and talking to trusted members of the community, you might say, hey, I know someone else who's doing work in the identified community, and they're doing something all about food insecurity. So maybe you want to connect. And so by garnering and talking with more people, you're leveraging yourself to identify more resources that you can have that are culturally relevant, but then also that can support other needs that a caregiver or family might have. So culturally sensitive adult day services strengthens caregiver networks within the community, thereby makes more resilient support systems for both the caregivers and the care recipients. Next slide, please. And lastly, aligning with policy and system needs. So policies that support culturally adapted respite care ensure that systems of care are accessible to a broader population. Often in my own research, when I'm interviewing caregivers who use adult day programs, a lot of people say, I love the adult day care I go to. I picked it for all the reasons because it checks all my boxes as it relates to what I want from a cultural perspective, or just from a needs perspective of having somewhere safe for someone to go. But a lot of times people say they have issues with just accessing the supports program because they lack the income or resources to have the person that they're caring for use the adult day service for a longer period of time. So I'm always trying to advocate and think about ways about how can we really advocate for policy and systems to make adult day programs more accessible. And that is so important because it can increase equity and access and also promote inclusive and sustainable models. So always thinking about cultural, linguistic, and social economic diversity and clientele. It might not be that because someone is of a minoritized racial ethnic group that they don't want to use a service. It might be something about affordability, or even having not having transportation to get to a service can be an issue as well. But really thinking about what are all of the needs that people have and how can we be inclusive in making sure that we're checking all the boxes so that we can take those needs out of the way so that we can provide access to high quality care, high quality inclusive care. Next slide, please. And it's really important to think about adapting these adaptations across the life course. Cultural and contextual needs are not static, they evolve over time as caregivers and care recipients progress through different stages of life. So you might be interacting with a caregiver who initially was working in, who was a working caregiver who had a 9-to-5, but they might transition to going to retirement or not taking on as many hours, but still thinking about how can these respite services still be utilized to help them too. These are always important because we know people change, their caregivers' journeys change, and this is associated with their different backgrounds as well. Next slide. So when I was putting this together, I think about how will we apply, or would think about the application of contextual adaptation. So I was thinking about it in a couple of different ways. So thinking about contextual adaptations that relates to location accessibilities, adult day centers, where they located, thinking about the clientels, also transportation options. It's important to think about if you're in a rural area, is it possible to have a van that can go around and to pick people up? Because I know rural areas, it could be a little bit more challenging as it relates to providing transportation. And also thinking about ADA compliance and making sure that those things are accessible. Hours of operation, having flexibility and scheduling based on family needs. I was just talking with a caregiver last week who uses adult day programs, and they were saying, if I had one additional hour, because the place that they were attending was from 9 to 2, and they said having that additional hour from 9 to 3 just gives them just a little extra help. Or even having flexibility and offering overnight services. All too often, sometimes respite people who use day programs are saying they just need overnight respite. So having a variety of approaches as it relates to flexibility in hours. And then always thinking about cost structure and financial support. Having different types of financial assistance is always so helpful. Thinking about how can you interact with city or local waiver programs to offer support services, thinking about Medicaid and Medicare coverage adaptation. So where there is some coverage, how can we make up for people who have gaps? And that's so key to using adult day programs. Next slide. So research and evaluation needs, and I wouldn't be a true scientist if I didn't talk about research and evaluation needs for culturally adapting ADS services. So there are several gaps in research. There is a scarcity of evidence as it relates to culturally adapting for different populations, including racial ethnic minorities, thinking about people who are LGBTQ plus caregivers, and also those of various socioeconomic backgrounds. There's so much more that needs to be understood about what type of supports are needed to really make these groups feel appreciated, and also making sure that we're being inclusive to different people's practices and preferences. Despite the growing recognition and importance of cultural adaptations, there is a lack of evidence that really demonstrate what are the best practices. I know previous presenters talked about some best practices, but there are a lack of evidence-based practices to really demonstrate how do we go about adapting these programs. So it's always great to build best practices so that these things can be replicated, so we can always think about how we're making services more inclusive. Next slide. So you might be saying, okay, well, if you've identified those gaps, Dr. Parker, why aren't you out there doing that? Because there are challenges and considerations. So all of this sounds good, but when you put this into being pragmatic or thinking about how to roll this out, there are challenges and considerations. And it wouldn't be right for me not to talk about some of these challenges. So some potential barriers to adapting care is that resources are limited. We're thinking about adult day programs. Oftentimes people are just struggling to stay open in a post-COVID world, thinking about how to get their census back up. But thinking about the resources it takes to adapt programs and staffing can be a huge issue with high turnover rates in adult day programs and being competitive. And then also some people are just resistant to change. We've been doing this for 25 years. Why do we need to change anything? If someone needs services, they can go somewhere else. And those types of attitudes can hinder progress, and then it also can hinder making sure that you're identifying and providing the services that are reflective of your community. So because of this, ongoing assessment is needed. And I have stakeholder here, but I'm trying to shy away from using the word stakeholder. So excuse me for using this word here in this context, but ongoing assessment, ongoing input from community leaders or trusted partners, and also community involvement. It takes time, and it also takes trust. Building trust takes a time, and it's not just you meet a person one time and trust is built, but this is an ongoing relationship. So in thinking about taking on adaptations, you really have to think about this as a long haul type of thing, because it requires this trust to build the relationships, to make sure that you're having the appropriate outreach, transparency, and community partnerships. And so time, relationship building, and also dedicated resources are all key to overcome barriers of mistrust and to ensure participation from all members, or all potential members or clients who could use your services. Next slide. So some key takeaways. There is a very important to think about culturally adapting care and tailoring adult day services to meet the diverse needs of caregivers and care recipients, because we know when we make people feel included and we include their values and preferences in the care that we provide, it enhances engagement, satisfaction, and it has positive health outcomes for both the caregiver and also the care recipient. As it relates to the value of respite model, culturally adapted respite services align with the model by supporting caregivers' well-being on the individual, family, community, and policy levels. Next slide. So some future directions. More research, expand research, more studies are needed to really evaluate the efficacy of culturally adapting resources among a variety of populations, and looking at this over time, not just as a one-time adaptation. There needs to be more development of metrics, creating some type of standardized assessment tool to improve measuring if we are culturally adapting services so that this can be replicated, and then also to ensure the accurate evaluations of caregiver outcomes. Next slide. We need to establish more best practices for implementing uh, adapted programs, because this will support providers in creating inclusive services for a variety of contexts. And then lastly, policy and advocacy for funding to really support culturally sensitive respite care is so important if we really want to be true to our word and saying that we want to create access to equitable services and high quality services that meet the needs of diverse clienteles. And this is my last slide. And so I also, in addition to being on faculty at Hopkins, I also um, co-lead the Health Equity Task Force of the Public Health Center of Excellence on Dementia Caregiving. And we are coming out with a toolkit on how to think about cultural adaptations. And this will be available in the next 6 weeks. So please be on the lookout for that. We have a website. If you go to phcoe.com, you can always stay abreast to all of the work that we're doing there. It's a great way to think about services and support. And we're always thinking about how do we provide high quality resources and care for state level institutions or anyone who wants to be a part of adapting programs. So thank you so much. I'll stay on if there are any questions.
Great. Thank you so much, Lauren. That was a great overview. Really appreciate the work you're doing. I want to echo that it's hard, especially from an academic lens. We'll talk a little bit about that later, that doing this deep community engaged work is not often recognized or compensated for properly in an academic setting, which challenges this work from many researchers. So appreciate you sharing that. If you have questions or comments for Dr. Parker, please feel free to post those in the chat. Again, we'll have time at the end for Q&A with all of the presenters. But if you don't want to lose those thoughts, feel free to post them in the chat and she can answer them in the chat if they're easy to answer that way. So we're going to move on, and I'm going to, our next presenter, I'm going to talk to you about a project that I led where we were looking to understand the respite care experience of Latinx families of children with special healthcare needs. So if you go to the next slide, you will see our project partners. I go to the next slide. There you go. This was a partnership with my research team at Marquette University, with a colleague of mine from Loyola University Chicago, and a nonprofit organization here in Dane County in Wisconsin called Padres Hijos en Acción. They work specifically with Latinx families of children with special health care needs and provide a lot of community-based support. We worked with them very closely to inform the cultural relevance of our questions and interpreting our results, and they are a long-standing partner. Mentioned earlier in the day today how, my work with this organization isn't just research. I volunteer, I show up to their Christmas parties, I donate gifts, I try to become a part of that community as much as possible. To ensure that there is a true, authentic, trusting relationship that is built. And it's been just an honor to have the opportunity to work with this organization. If you go to the next slide, you will see my research team, and I share this. This is a picture of us from the International Short Break Association conference that was held in Poland in 2023. Just to acknowledge that on my research team for this project, I had all of us who speak a little bit of Spanish, which I think is really important. Three of them who are fluent, bilingual in Spanish and English. And we also have my project manager, Tyler, who's pictured in the middle, who is an individual with a disability himself. And so really trying to model the recommendations I share about, hiring people from the community, making sure that you are equipping your team with the resources to do this work is really important. Next slide, please. So I'm not going to spend a lot of time on this definition, but this is the Maternal Child Health Bureau's definition of children with special health care needs that I'm going to be using. It's a very broad definition for the purposes of this study. If you go to the next slide, you will see the disparities in respite care that we know about. There's not a ton of work in this area, but there are some work I've done in the past. And so what we know about disparities in respite care is that the respite care needs are unmet for Latinx families. The prevalence of unmet needs is 2 times greater in Latinx families compared to non-Hispanic white families. There are obviously cultural and linguistical barriers to the existing respite services. There's also a gap in resources to serve racial and ethnic minorities, and we need more research to help create culturally and linguistically appropriate respite interventions, as Lauren mentioned in her presentation previously. Like we don't have a lot that is meeting those cultural needs. Next slide, please. So the purpose of our pilot study was to better understand the experience and needs of Latinx families of children with special healthcare needs, specifically related to respite care. Next slide. This was a mixed method pilot study. It was a community engaged research project. We used an online anonymous Qualtrics survey that was offered in English and Spanish, so people could choose how they answered the question. We did have incentives for participation, which is a really important aspect, again, with equity to try to honor the time and effort that is put into completing and engaging in research projects. And then we gave people at the end of the survey the option to participate in an interview, which was the second half of our project, where we led in-depth one-on-one semi-structured interviews that were conducted either virtually or in person based on the choice of the caregiver. And these were, again, conducted in either English or Spanish based on their preferences. Next slide, please. So just to give you some context of where this work is done, Dane County is our capital sits in Dane County in Madison. And this is the county that we recruited from because that's the geographic reach of the local organization that we partnered with, Padres Hijos and Acción. Next slide, please. This lists the eligibility criteria. As you can see, we recruited parents or guardians of children who are under 21, that self-identified as a member of the Latinx community, could read, write, and speak in English or Spanish, live in Dane County, tolerate an interview if they elected for that, and had access to the internet if they wanted to take the survey, and of course had to be willing and interested in participating. Next slide. We used a couple different survey measures. So we gathered demographic information. We included a couple validated measures, including the Global Family Quality of Life Scale, the Family APGAR, which measures family functioning, the Perceived Stress Scale, the 10-item version, and then asked questions about their experience with respite. These measures were all translated to Spanish and back translated by our study team, and reviewed by our community partner as well for cultural relevance. Next slide, please. So 2 of the measures we used were already validated in previous studies in Spanish. The Global Family Quality of Life Scale has not been, and so part of our project is also validating the Spanish measure, and a process that we're still ongoing. Next slide, please. Our semi-structured interview guides for those participants who elected to participate in the qualitative piece of our project, we developed questions informed by the literature, our professional experience, as well as input from our community partner. And we asked things about how rewarding and challenging the care for their child was. We asked them to self-define what family quality of life meant to them. We asked them about other stressors, what kind of support they get, and specifically asked them to share their experience and recommendations around respite. Next slide. So I just want to highlight within our methods for our study, again, we didn't have this wonderful value of respite model before we designed this study, but it's kind of retrospectively fitting the value of respite model to our study. I think we actually did a really good job covering a lot of aspects of the value of respite model. We definitely had questions looking to understand the context of the caregiver and care receiver and the family. We tried to understand a lot of the factors involved in the respite process, their identification of a caregiver, their need for respite, how willing they were to accept respite, if the respite they had met their needs and their satisfaction with respite. And then for outcomes, we did ask them about some of their mental health, stress, and quality of life measures as well. So again, if I had this before, I'd probably add different things, but we'll talk about that in our next steps as well. So next slide. For analysis, for the survey, we exported the survey results from Qualtrics and imported them into SPSS software. We ran descriptive statistics, correlations, and some regression analysis. Next slide. And for the interviews, all the interviews were audio recorded, transcribed verbatim. Names were removed during transcription, and we used thematic analysis with consensus coding, which meant at least 2 members of our research team are reviewing and verifying that the themes we identified are appropriate. And then the preliminary results of this will be shared with our community partners as well to help validate our interpretation of these findings, which is an important aspect of that member checking. We're still in the middle of this, so we haven't done that yet. Next slide. So these are preliminary results. We have completed our survey portion, but we're still recruiting people for the interviews. That has become more challenging to schedule than initially anticipated. So we've only completed 3 interviews to date. We had, I think, 45 of the 48 people who completed the survey said they would be happy to be interviewed. So we have lots of people wanting to be interviewed, but we just haven't had the chance to coordinate them all, and we'll continue those recruitment efforts. There were barriers to the online survey. We learned really quickly, even though our community partner thought that would be a good way to do it at first. Quickly realized people didn't want to do it online. They wanted a paper copy. So we put an IRB addendum, made a paper version, and pretty much everyone completed the paper survey in Spanish. So we ended up then taking those paper surveys, having my research assistants add those responses into Qualtrics so we could analyze them that way. Next slide. So just again, some summary data from the results of what we have so far. Most of the respondents who participated were married females, sort of middle age like me, had a high school diploma or GED, and about half worked full time and about a third were unemployed. Next slide. We asked about annual household income, and you can see a pretty wide range of below 20,000 annually, all the way up to just under 100,000 annually. So a pretty diverse representation of household income. Next slide. We also asked if they ever received respite, and we did define respite to them. So we explained what it was to help overcome that term respite as well, and with help from our community partner in that definition. And of the participants in the study, majority, almost 70%, said they never have received respite. Next slide. We asked, why didn't you receive respite? I just want to make note that only 4 of the current respondents, so 8%, were currently receiving respite. And these are some of the responses we heard. Some people said, I don't know what respite is. Not having full legal status was a barrier. My son is not a citizen. I prefer to take care of it myself. We've heard a little bit about that cultural sense of responsibility. I don't know this sport existed, and I haven't heard of it. So again, a lot of awareness and the terminology I think that we use in getting that out to folks as well. Next slide. Those who did know about respite, we asked them, how did you learn about it? And more than half of them said they learned about it from the community organizations. I think it's really important, again, to recognize how valuable those community partners are in helping to promote respite programs and getting the word out. So having that trusted representative from the community who can help liaison to the community is really important. Next slide. So related to respite access, some of the themes that came up is that most of the people who received respite received it in their home on an as-needed basis. It was funded by public or governmental funds. They didn't have transportation provided. Almost half of them said they were on a wait list for services, and about half reported that they either had to reduce or didn't have any respite during the pandemic. We did throw in a COVID question in there as well. Next slide. We also asked what barriers or challenges they felt they faced in receiving respite care, and here are some of the themes from that. What people said, their son's behavior. I found that in my experience and research I've done is that families who have children that have different, commonly referred to as negative behaviors from their child's condition often struggle to find respite care, get sort of kicked out of respite and other services because of that, which is, I think, a symptom of the lack of training that we have for managing challenging behaviors. There's people said there's no workers, there's a long wait list. Again, that citizenship came up, the language barrier, and then just not knowing how or where to get it was a challenge for some families. Next slide. So for the demographics of the children with special health care needs, most respondents had just one child with special needs and then had other children as well. The average age of the child with special needs was 14 years old, and the most common diagnosis was autism. About 75% had autism, and most of them were diagnosed by the age of 5. So early, had opportunities for early intervention. Next slide. We asked caregivers, how many hours a day do you spend taking care of your child? And you can see this ranged across the board from 0 to 4, but the most common selected, over a third of them said they care for their child 20 to 24 hours a day. So they are the sole independent caretaker of their child, providing for their needs around the clock, which we know is common for a lot of parent caregivers. Next slide. We also asked, has caring for your child affected your employment? And again, this is something that I've seen in previous research I've done and in the literature. You see that about a third said they had to reduce hours. Just over 25% said they had to stop working. Another quarter said it didn't affect their work or it wasn't applicable, either they didn't have employment to begin with or other reasons. So again, based on this, over 50% had to stop or reduce hours because of the care needs for their children, which we know is a huge economic impact on families as well. Next slide, please. And then I just threw in one quote again. We only have done 3 interviews, so we don't have that qualitative analysis on yet, but I found this quote sort of as a quote that I felt really captured the importance of the cultural and linguistic competence of programs. This mother said, it would be nice to have somebody that knows your culture because they know, for example, how to prepare a food that the kid would like. How do I talk to the kid? And not only the language, but respect different ways that we talk to each other. So it's not just about linguistic translation, it's the cultural context, it's knowing really how to care for that person in that cultural context that matters to these families. Next slide, please. So next steps, again, we're going to continue to recruit for additional interviews and try to re-engage with the group and have some additional analysis and the validation of the measures under works. We are hoping to use the results of this study to apply for funding to broaden this from a pilot to more of a statewide or a national study. And then we do plan to continue to collaborate with our community partner to develop and use this information to develop a culturally and linguistically appropriate respite intervention to help these families. And of course, we'll be sharing our findings and recommendations for funding and public policy at both the state and national level. Next slide, please. So I just want to kind of check myself on this. This is sort of my self-check on those questions I talked about earlier today. And, I really try hard to practice what I preach around these things. With this project, we checked all the boxes on these except for having the community advisory board for this project. It was just a pilot, but I do have community advisory boards for most of my other research projects. I think it's really important to be engaging people in the research who are impacted by the community. And so, this just kind of highlights how important I think these things are. And hopefully you saw some of this come up in my presentation of this research. Next slide, please. So thank you. You can learn more about Padres, the EOs, and ECCHO here, or contact me if you have more questions. And again, feel free to post questions, comments in the chat now, and we'll get to those in the Q&A. But I want to, without further ado, move us on to our next speaker. So if you want to advance to the next slide, Marcia, we are going to now hear from Kadijha Marquardt-Davis, who is going to talk to us about ECCHO. I'm very excited for this presentation.
Hello, everyone. My name is Kadijha Marquardt-Davis, and I am the founder and director of ECCHO. Next slide. There we go. So ECCHO stands for Engaging Communities to Change Health Outcomes. Our mission is to center the voices and lived experiences of BIPOC women and non-binary people to drive policy change and transform local systems of power. ECCHO was created as a way to improve health outcomes by using concepts rooted in civic health. So public health researchers have long known that the civic health of a community contributes directly and indirectly to overall community health. And I can also say that civic health is probably a new term that a lot of people have not heard of. And so civic health is defined as the degree to which citizens participate in their communities, from local and state governments to interactions with friends and family. Moreover, civic health measures the civic, social, and political strength of a community. So what does that mean? So civic strength is characterized by the level of individual engagement and the community's capacity to work together to resolve collective problems. Some very specific indicators of this include volunteerism, group participation, charitable giving, and collective action. The social strength aspect of this captures the social ties, networks, levels of trust, and exchange of knowledge and ideas in a community. Some indicators of this include trust in neighbors, confidence in institutions, access to and use of information, and then interactions among family, friends, neighbors, and groups. The political strength gauges the extent of interactions between citizens and government, and indicators of this include voter registration and turnout, interactions between citizens and elected officials, the ability to express your political opinion, and then also engagement in public dialogue, processes, and decision-making. So as a result of this, states with more inclusive voting policies and greater levels of civic participation tend to be healthier overall. Next slide. So what does this all mean, and how does this relate to ECHO? So ECHO is a civic engagement training program that seeks to improve community health outcomes by engaging those most impacted by generational and systemic racism in Dane, Milwaukee, and Rock County in Wisconsin. We are committed to community-based leadership and decision-making that centers the views and experiences of those most impacted by an issue. So during our 2-year, well, it was 9 months. It was a 9-month program, but we, based on feedback, have since transformed it into a 2-year training program where participants work together as a cohort to design and implement a community-based project that meets the health and civic health needs of their community. Each cohort is overseen by a local program coordinator who pays participants for their work and provides them with the training and resources they need in order to successfully implement their project, drive policy change, and transform local systems of power. We also require our local program coordinators to live directly in the communities that they serve and to look like and reflect back the same culture as the people that they are working with as well. As part of the program, participants go through the curriculum I designed, and they learn basic things like Civics 101, how to do a community needs assessment, basic community organizing skills, how to tell their stories and be able to advocate around those particular stories. And as part of the program curriculum, cohort participants are required to directly engage community members, local organization, government officials, and key stakeholders when developing and implementing their community project. So through this, ECHO fosters relationships built on respect and trust. We build power among community leaders and increase the community's capacity to be able to influence decision makers and stakeholders. Next slide. Here are just some quick goals that we have here at ECHO. So we seek to improve the overall health and mental health of our program participants, increase levels of hope and civic participation. We also want to be increasing their confidence and leadership skills, as well as improve civic health outcomes by strengthening the civic infrastructure of each county in which we work in. Oh, and then I'm so sorry. I also forgot to mention that our Dane County program is run entirely in Spanish as well, as that is a need that we found within the community there, is being able to have culturally relevant, culturally specific, and language specific programming for our Spanish-speaking members in Dane County. Next slide. In terms of outcomes, we seek to strengthen the social cohesion amongst participants in their communities Social isolation has come up as a major issue. I believe it was, who was it? The Surgeon General literally just came out with some new research showing how bad social isolation has got and how that impacts people's overall health. And so we really seek to strengthen social cohesion amongst our members as a way to improve health and stabilize health amongst our members. We're also hoping to just see an overall increased civic participation, improved health and well-being, and then increased access to information on public issues. Next slide. Okay. And the actual reason why I'm here today is not just to talk to you about civic health, but to also talk about ways in which you as researchers can engage in community-based research. So one of the many things that we do at ECCHO, before we even really get into our curriculum or our programming, is we dare our participants to dream big and to radically imagine a better world. And radical imagination is actually something I'm really passionate about, and it does have a defined term. So radical imagination is the capacity to envision fundamentally different social, political, or economic structures that challenge and go beyond the constraints of our current systems. It's about imagining new paradigms for how society could operate when we don't have to live under the isms. So that's racism, capitalism, sexism, ableism. These paradigms aren't merely reformative tweaks to existing structures, but represent a transformative shift that redefined what is possible or desirable. And the reason we have our participants start off with this concept of radical imagination is so that when they are looking at their communities and the issues that their communities are experiencing, they don't just stop at trying to solve the problem as it currently is. We want them to go beyond and to think as outside of the box as they can to solve these problems. So to do this, we sit down with our participants at the very beginning of our program, and we literally run them through a radical imagination exercise. So how we do this is we have them all sit in a circle, close their eyes, and then we ask them to imagine a future where there are no barriers in society that stop them from solving problems. So we tell them if money isn't an issue, if all of the barriers that exist in your life and society did not exist, what would your future feel like, taste like, and smell like? Would people have free, would housing be free? Would would education be free from, birth all the way up through university? Like, what would that look like and what would that feel like? And then we ask them to sort of work backwards from there and figure out the steps that would be needed in order to achieve this goal and this view of a world without barriers and living without the isms. We then also really focus in on how their perceptions of themselves might stop them from dreaming and thinking big. So, for example, like, is there something in your life that has told you that, I don't know, that maybe that you are not worthwhile, or that your voice or your opinions don't matter? Do you feel this way about yourself because this is an original thought, or is this something that you feel because of the systems that we live under? And we really push them to dream as big as possible so that we can, once again, radically imagine different futures, come up with different methodologies, different practices, and different ways of being so that we can solve these really big issues within the community. And then for researchers, I believe that radical imagination provides a conceptual framework for thinking beyond traditional and incremental change. So it involves engaging with possibilities that literally might appear impractical or idealistic, yet hold the potential to inspire profound shifts in how problems are approached. So as an example of radical imagination within the context of Respite, care and research, could involve re-envisioning what respite care for caregivers, could involve re-envisioning what respite care could look like for caregivers beyond traditional models, by centering the care experience on principles of equity, community, and well-being, rather than just on the sole, temporary relief for caregivers. So radical imagination in this context means thinking of respite as an opportunity to transform the structures around caregiving rather than just relieving immediate stress. So how can we foster community amongst respite providers, healing and empowerment? Like if many of the barriers that people that do exist no longer existed, what would that look like? And then how do we work towards that on a step-by-step basis? So in this way, radical imagination can be used as a tool that can help researchers conceptualize and advocate for transformative futures by providing a foundation for pioneering theories, methodologies, and practices. Another thing that we do within ECHO is that we utilize community-based participatory research. And the reason we do this is because historically, people have come into communities, but especially communities of color, and have tried to tell those communities what to do or phrase things in a way that make it seem like the way those communities already have been existing is incorrect. And at ECHO, we actively reject this notion. We believe that people and communities know what's best for them and that they already inherently have the knowledge and experience needed to solve these issues within their community. And that's why we like to use CBPR. And then some of you might know what CBPR is, but this might also be new for some of you. So community-based participatory research is a collaborative research approach that actively involves community members in that research process. So rather than, you as the researcher just simply going in and studying the community from the outside, CBPR makes the community an equal partner within that work. And the community works with the researchers from start to finish. So this includes everything from defining the research question to collecting and analyzing data to interpreting results and applying those findings to create positive change. Some key principles within that include partnership and collaboration. So this means that researchers and community members form a partnership based on trust, respect, and shared decision-making. And this ensures that the research is relevant and sensitive to the community's needs and the context in which they have to live. Another principle is that it is community-driven. So research questions, goals, and methods are driven by the needs and interests of the community, not just the researcher's agenda. And the goal is often to address real issues affecting the community, such as like health disparities, or in your guys' case, like respite challenges, and then social inequality. CBPR is also mutually beneficial. It aims to provide benefits to the community beyond just knowledge. So for example, like a health study might also improve local healthcare services or increase community capacity for future projects. It is also heavily focused on empowerment. It is about building the community's capacity and giving community members a voice in the research that affects them. Ideally, community members also gain skills in the research and advocacy skills and problem-solving skills that they can use in the future. It is also action-oriented. So it's not just about studying an issue, it's also about creating actionable solutions. And findings from CBPR are meant to lead to tangible, positive changes within the community. So overall, CBPR can lead to research that is more relevant and respectful and impactful for the community. And by involving community members, researchers can gather deeper insights and create solutions that are better suited for the community's unique needs. And so how we do CBPR is we talk so much with our cohort members. So how the program is actually laid out is that program participants, cohort members, They attend 2 meetings a month that are each 3 hours long. Each meeting kicks off with an hour-long facilitated, or sometimes unfacilitated, just discussion, and like we call it a healing circle, honestly. And this gives our participants an opportunity to share what is going on within their like daily lives, any struggles that they might be having. Sometimes our local program coordinators will have facilitated questions for them, asking about their perceptions of society, the structures that we have to live under. But it is mainly women sitting around and having time to share their unique and personal stories with one another. And as a result of these conversations that happen over like a decent amount of time, the stories the women share often reflect what is going on in the broader community, and we learn things about them that we otherwise wouldn't have. And in a lot of instances, over the course of the 2 years that this project has been going on, it is through this talking that they come up with the idea that they want to use for their projects. So for example, I won't say a lot, a decent amount of the people that participate in our program are food insecure. And the only way we found that out is by building up the trust and these relationships within these cohorts, so people felt comfortable to talk about that food insecurity. And so as a result of that, one of our cohorts actually decided to make their project all about improving access to food share in Wisconsin. As of right now in Wisconsin, in some instances, you are not able to purchase hot food or food from restaurants if you receive food share. And so that means if you're a college student or disabled or an elder, or homeless and don't have access to like a kitchen or a way to like actually sustainably feed yourself, that you often like go hungry or have to eat food that isn't satiating in a lot of ways. And so their project was all focused on trying to get the state of Wisconsin to request a waiver to be put on the hot meal program that they have at the federal level. Another project people did as a result of these ongoing conversations and, feeling comfortable and trusting the people around them was someone in another one of our groups was experiencing homelessness. And as a result of this sharing, they made their entire project about improving housing access within Beloit, so Rock County in Wisconsin. And it's just through these ongoing like conversations and relationship building that we were able to pull these things out. On top of that, we really leave it up to our cohort members to be the leaders of the program. They're the ones that are helping to define the problem. They're the ones that are helping to develop the methodologies that they want to use to implement. And we are just essentially there to act as a way to resource them up so that we can achieve the projects that they want to implement. Another thing that we really focus on is people first. At ECHO, we seek to meet as many of the basic needs as possible of our participants so that they can show up and be engaged. Like people are poor, people are tired, people are hungry. People have so much going on in their lives. And so as a program or a researcher, just showing up and thinking that you can like request the time of people that are already not having their basic needs met, I think is a bit of a stretch. And so that is why we really make it a point to pay our participants. They receive an hourly wage, but then on top of that, we also offer up transportation options. We try to provide childcare for people during the meetings. And then at these meetings as well, we have food. We have food because, once again, people are experiencing food insecurity, and fellowship as well. We also make it a point to, I always tell my LPCs that I want them to be there walking alongside our participants as well. and offering fellowship, and then being able to bear witness to their struggles and walking alongside them as they're experiencing those struggles. Because in my opinion, that is how you build trust, and that is how you build relationships with people who are experiencing really tough things, but then you also need them to continue to show up so that change can be created. So just knowing and remembering that building relationships and trust means that showing up as a person first and a researcher second is going to be the most important thing. And then finally, a thing that we always like to keep in mind when working with communities, but especially when working with communities of color, is knowing that it's not about you as the researcher. If you have a huge ego, if you think that you're just going to come in and be able to tell people like how you think that they should be living their lives, that's not going to work. And so being open and having humility about how you enter into these spaces is going to get you so much farther than just sort of coming in with your own agenda. Really taking the time to sit there and listen to people and build those relationships, it's so invaluable, honestly, because 9 times out of 10, you will end up finding out things that your initial assumptions never would have arrived at. So just by sitting and listening and taking the time to like really hear people and listen to their stories and understand that qualitative research is just as important as quantitative research will get you so much farther. Next slide. Thank you. No, that's not precisely all about respite care, but I think it's a great way of learning how to be by and for the community and knowing how to really ingrain yourself in the community as a researcher so that you can show up and actually provide people the things that they need outside of your own sort of basic agenda. So thank you.
Thank you so much, Kadijha. That was amazing. I took so many notes and highlighted so many things you said. And, you know, I hear the quote, nothing about us without us, right? Like recognizing how important it is to honor the community as the expert. And I love your last comment about setting your ego aside and, you know, your person first and show up to these spaces with that humility. You know, and that's, again, I alluded to this earlier. I think some of the challenges we have as academics is we're not necessarily paid or incentivized or even acknowledged for our work building that community trust, and that's a system issue we need to continue to change in academia. But you know, me coming on a Saturday in my sweatpants to the bounce house party of the kids with special needs is not something I can put on my CV. It's not something Marquette's going to pay me to do, right? But it's so important to being there with the community. And so I just want to thank you. The work you're doing is incredible. I also have to reflect that I love the radical imagination piece, and it reminded me of a really good image that I'm going to post in the chat that we probably shouldn't record, but it's I have to share it because it's something I use a lot with like the people I enjoy working the most with, and I feel like you're one of them, so we need to work together. And I think many of the people that are part of this the summit today are here because we are dreaming big. We come at this as real people, and we really want to get stuff done, right? Like we want to make lives better, and I think it's just important for us to remember that that really does need to be driven by the people we're trying to serve, right? The caregivers, the people, the families, the people with disabilities and special needs that are receiving this care. So I thought you did a great job closing us out on that. So thank you. And I could talk for hours too, but I won't because we're now moving on to panel Q&A. So I'm going to put my facilitator hat back on and invite folks to share questions, comments. Marcia, I think you can probably remove the screen share for Q&A so we can all see each other. Would love for people to unmute and ask questions or comments or pop them in the chat as well if you have things you'd like to share. Susan, you had a comment. Do you want to unmute and say that, or you want me to read it?
You can read it.
Okay, it says Kadijha's presentation was so clear and fresh and so free of jargon while getting at really important issues and offering practical guidance that makes you glad to be part of the human race and be involved in this good work. So thank you. I echo Susan's sentiments there. Jill, I see you're unmuted. Did you have a comment or question?
I'm just blown away by all the presentations today, and I'm trying to absorb all of it. And thank you all so much for the great content that you gave us today. I did have one quick question for Lauren, if she's still on. Could you talk a little bit more about what we might expect in your toolkit on cultural adaptation of dementia care? And I think you said it would be available in about 6 weeks. Is that correct?
Yes, in about 6 weeks. But if it's not 6 and 7, please don't email me and say, when's it coming? Because it's coming. But thank you for that question. So the Bold Center is all about how we can really help public health, state level public health agencies and people who are just providing public dementia care support, really providing technical assistance in any way, in any capacity. So for our toolkit, we've gotten a lot of feedback from agencies really saying we really want to adapt our programming and really want to be mindful about how to do this. So in our toolkit, what to expect, we cover some of the key racial ethnic groups. So we're focusing on Black, African American, Hispanic, Latino, Native or indigenous populations and other populations as well, focusing on these key populations because they're at risk for having dementia and also thinking about the considerations for those groups. And so we highlight what are key factors when you're engaging in developing support programs for these groups. So highlighting some of the key factors and also highlighting what we identify as best practices so far. I've said already that we need to develop more, but we've really tried to outline about what are some best practices about how to approach and developing support, and then also giving a lot of examples of programs that have already been developed. It's a living document. We're always adding to the document. So we have it ongoing and it's continually being built. So it's a living document. So if you come across anything that you think might be helpful as you're reading it and using it, please let us know. We're always thinking about how we can better our supports and services.
Great, thank you.
Thank you. I see Doris has her hand out.
Hi, I'm sorry. I'm just like I'm like a kid in Disney World. This is wonderful today. This is like I'm just drooling. But I'm on my way for the next class, so I have to choose my battles. How can community-based organizations like myself and like other that we serve? The issue is always funding when it comes to having respite programs and serving these special populations. The issue is always funding because you have to make sure you have the right staff available. So how do we talk about that? How do we support research but still pay our rent and hire the appropriate people? Because one thing is, we're a daycare. It's like, great, we have daycare staff. That's not specific. You might need some dementia training. You might need some specific people that really understand this community. So, I mean, how do we back into that? That's kind of where I'm stuck. This is amazing. And I thank you so much for bringing all these resources and tools to us. Now I just don't know how to use them.
Yeah, no, thank you for that, Doris. I'll chime in and then invite others to come in too. I think that's always been an ethical issue for me too, is I preach a lot about we got to tailor, we got to have things culturally, linguistically congruent and, have a variety of programs that meet everyone's needs. But at the end of the day, right now we don't have enough money to meet the basic needs of respite, right? Like, if there's limited funding, is any respite better than no respite? I think that's the challenge that we face. And I think it comes down to continued research to show the value of respite, to show the cost savings of respite and outcomes that it can create, and cost savings it can produce, and just understand that it is the right thing to fund. And our continued research and evaluation efforts can inform advocacy and policy changes to enhance that. But you're right, it's hard. We know what we need to do. And it comes back, I think, to what Kadijha says is, like, if we could dream big, we could all right now dream big what we think it should look like, what the landscape of respite services and what those programs should look like. And now we got to just work backwards and figure out, like, what's that first step we need to do to move it forward. And I think a huge part of that is capturing the data and not just the quantitative data, but the stories, the powerful stories that these caregivers have that can tell others how important this service is for them and how, how it's so needed. And to remember that, as Rosalind Carter says, like there's 4 types of people in the world, right? Like this is always going to impact everybody at some point, right? You're either a caregiver, you either will be a caregiver, you're going to need a caregiver, right? Like all those things, like this is a universal issue that's going to impact all of us at some point in our life. And we got to start offering the supports that are needed. So that's my soapbox. I'll let Lauren and Kadijha chime in if they have other thoughts on that.
No, I think that you wrapped it up beautifully, Kim. I mean, Doris, I always am team Doris and everything that people are doing in Central de Amigos. But I think it's so great that you are even taking the initiative to be a part of these types of conversations, and then also to think about being engaged in research. As somebody who does do a lot of home and community-based research and adult day programs, it's oftentimes not a lot of people at the table representing the voices that you represent. And so I think even being at the table to say, hey, we need to be aware of the needs of underrepresented populations is so key and so important. So for that alone, existing in that space alone, if you did nothing else, I think is a huge part of advocacy. So I think you're doing the right thing already. And so please continue to do that, and to encourage other people who are engaging in those clienteles who are not typically represented, encourage them to be a part of research. There's a huge barrier in itself with a lot of these communities that we're talking about who need to be better served with them even engaging in research or talking about research, because there's a lot of mistrust with academic institutions and institutions in general. So building that trust, being that face, being that middle person, being that lever, being that broker for researchers like myself to come and engage with you is so key and critical.
Excellent.
Yeah. And yes, I recognize money is always on people's minds. It's always an issue. And yeah, just as Kim said, like those collecting as many personal stories as you can as possible to give to funders, or even taking it. So in a prior life, I worked in the state capitol in Wisconsin as a policy advisor. And for us, like receiving stories from people really did help to put a face and names and everything to those policy decisions that were being made. So as much as you can capture that, and then making sure, that the voices that are being shared are truly representative of the populations that you are serving. And even figuring out ways to get those populations in front of decision makers, I think is even better, because that allows them to be their own voice essentially, and look at people and tell them what they need as well.
Thank you. I see a comment from Donna for Kadijha, just recognizing that housing is an issue and that lack of cooking facilities. And I also thought that was really important to recognize too, like the hierarchy of needs, right? Like for a lot of these populations, when you say you need a break from caregiving, they're like, I need that after I need a safe place to live, education for my kids, food, a job, there's these other things that often take so much more priority in people's lives, though, so we have to be open to that and meet those needs first before we even talk to them about these added support services that might be helpful. So I think it's a very holistic way of thinking about how do we support caregivers. Respite may be about helping to support some of those basic needs as well. Lots of great comments and feedback in there. Phil, I see your hand up.
Yeah, first of all, I want to say to Kadijha, I'm so moved by the quality of the work that you're doing in your 3 counties in Wisconsin, and I so wish we could replicate your work around the country. We're in desperate need of it. We're also talking, I'm hearing from the researchers that we really need to build community advisory boards and community partnerships so we have real lived experience as part of our research. And there've been so many comments in the chat over the last 3 days from the respite service providers saying, how do we engage with these other communities? We don't even know where to begin. So I'm wondering if any of you have really concrete steps for how researchers can find and connect with these partners in the community, as well as how, we've heard a lot about you need to find that trusted person in the community. And I hear that over and over again, but how exactly do people do that? If you're a service provider or a researcher, how do you find those trusted people to reach out to? Does anybody have an answer to that? I don't know.
Yeah, it's showing up places, honestly. It's literally bringing yourself out into the community. It's attending events. It's literally putting yourself out there in a lot of ways. So I don't know about you, but like there's so many Facebook events, there's so many things usually going on. And that's usually the vehicle into those spaces. And like honestly, like getting tapped into like the social justice spaces within your community is also is a great way to really find people that are on the ground doing the work. And so yeah, it's just
Getting there.
Showing up places, yeah.
Right. And like Kim said, she doesn't get paid to go to those bouncy activities with her kids. So again, I would encourage people, and again, money is limited, and I know we can't even find enough money to provide the services or the food or the housing, but our consultant Tawara Good with Georgetown University Center and National Center for Cultural Competence, who reviews a lot of grants, she always says, if I see a grant application and somebody's listing I'm going to do cultural competence and I'm going to do linguistic competence, she goes right to the budget and she sees if there's a line item there to actually allocate some of the resources to do that. And if she doesn't see that, she takes points off of her grant review. So, you know, I do worry that it does come down to funding in the end and people's time. And how do we begin to prioritize this within the budget and within the work that we're doing? It's so difficult given the limited resources.
Yeah.
I think it's,
Well, go ahead,
gonna
Lauren.
say, I think it's definitely always funding. I mean, I need $100 million for every grant I do. But
Right.
it's always funding. But I also think if I were to give another talk about just community-based research, I often say that I think engaging with community, it's like dating, right? Like when you're dating someone, you don't, oh my gosh, I have to get back in the dating pool. This isn't a dating conversation about how to get on some type of match.com, not at all. But if you're dating, you just have to get out there, right? Like, you know, the qualities, you know, you're looking for, you know, what you're bringing to the table already. So you know what you can advertise about yourself and your organization. But it's like dating. You have to just get out there. Some dates you can spend a whole bunch of money to go out to a nice restaurant. Some you just need to show up and just be present. And I think that that's so key. Like there are already so many community events that are already happening. If you just come and show your face, like say, hey, maybe I can't give you $100 per hour to be a part of a listening group, but I can come and I can be in the kitchen and I can help you set up. I can help you clean up afterwards. I can do all those things. Those are just showing up, showing face. Those small things just demonstrate that you're invested in any way. And just acknowledging people is so, those small things don't cost anything, can take you so far, because you never know who you might meet when you're in the kitchen cleaning up. You might meet somebody else who's doing similar work who you can build upon and do things with. So just showing up, being yourself, knowing what you're bringing to the table, and then knowing what you're trying to accomplish, I think gets you far.
Yeah, I love that, Lauren, the dating analogy. I also think there's extreme power in the funders. So Ronnie and Ken, right? Like this needs to be something that is invested in. It needs to be written into every proposal. I think we're getting better at that. There are some grant RFPs out there that ask for community engagement and partnership, but it needs to be more heavily funded to be done. You know, it's just like in the healthcare system. If it's not a billable service, it ain't getting done in the doctor's office, right? In research, if it's not something we can charge to the grant, it's hard to get done. But there are ways, I think, around that a little bit. I think you can look at it, especially from like a programmatic standpoint, like your work, that's your community engagement, that's your outreach, that's sharing resources, right? So that could be folded into some of the work you do. But again, there's limited time and staffing, of course. But I think we just have to get creative with how we do it and value it and know that it is so important. We aren't checking boxes, right? We're baking this into our work. It has to be part of what we do, who we are, if we really want to do this work. And it's a culture shift, I think, from a funding grant making, even like I said, academic setting, that, you know, this is how it should be done. This is authentic. This is meaningful. It's going to result in more positive change. We're going to have, like Kadijha said, real actionable things happen as a result of our research, instead of just a publication that, you know, other academics are going to read. Like that's important as academic currency. But, you know, those of us who are really committed to making real change, like we need more than just the publication and the research article. We need this to translate into policy change, practice change, funding change, reach back out into the community so it empowers the work that they're doing every day as well. And that takes time, effort, and we just got to start, investing it in a different way. Okay, let's see. I see some agreements in there. That's great. Any other questions, or we have just another minute here? Any closing comments from my fellow panelists, Lauren or Kadijha? Okay, so before we go share the last screen, I have a favor to ask everybody, because this is our last day. I'd really love a picture of all of us. So I know some of you are camera shy and you may have showed up in your pajamas, and that's okay. But if you wouldn't mind showing your beautiful faces, I'd love for us to get a group photo to just show everyone that we're real people on here, connect with each other, and have a nice image. So I'll give you a second. Hopefully we can get the full screen filled up with your beautiful faces. So this is my virtual selfie I want to take with the audience. We'll give it just another minute. We're almost full. Okay, I'm gonna get my camera up, so I'll take a couple. So everyone's cheese, smile. And then if you wouldn't mind doing me one more favor, if you could everyone unmute, and just give a round of applause to Jill Kagan, everybody. I'm very honored to have the opportunity to work with Jill. Jill works tirelessly on everything she does for ARCH. This summit being, a perfect example of like the culmination of the great work that she leads. And it's such an honor to be a part of this. And I know each of you have been enriched through the work that Jill is leading. And I hope everyone knows that, ARCH is Jill. It is Jill.
That's not true.
We hear about all this work that ARCH is doing. It is Jill. And then with help from a few of us, right? And so she's very humble, and she would probably be mad at me for doing this, but I think it's really important that she knows how appreciated she is, how valuable the work that she is leading is to not only the respite provider community, the research community, but the caregivers that are ultimately impacted and served by this incredible work. So my heart is full. I am grateful for each of you being here and taking time over the past 3 days to be a part of this important work, and especially grateful to Jill for all of her leadership in this. So thank you.
Thank you, Kim. And I really, really do appreciate that acknowledgement. But I do have to say, I am totally dependent on the incredible team of consultants that I work with, and just as dependent on the amazing respite network that we have of the Lifespan Respite grantees, the State Respite Coalition partners, the respite provider agencies, the family caregivers who are a member of our network. If I didn't have the guidance and the information and the input from all of you, all I do is facilitate all the incredible work that you are all doing. I'm just the facilitator. So I owe a tremendous amount of thanks to all of you for just the great work that you do, and sharing, being your willingness to share the work with all of us is a tremendous gift. So thank you all very much.
Thank you. Okay, Marcia, if you could just pull up the last couple of slides, we're going to wrap things up here today. So I want to just highlight our summit objectives and hope that after the end of the 3 days, we have done all of this. We feel confident that we did. I'm just going to highlight the last one, the call to action. Again, our hope is that the summit isn't just a thing you did. We hope that you all walk away from this with some valuable action steps, energy, motivation, and inspiration to continue to advance respite research, because we know that by doing that, we are ultimately strengthening the support services to these family caregivers and improving lives. So I hope that you all walk away with that inspiration and know and make that list in your mind of what you're going to do as a next step to make this happen. The next slide asks you all to just pop in the chat real quick. Just one key takeaway from day 3, or even if you're reflecting over the whole summit, we'd just love to know, what it is you're taking away from this. It's really valuable for us to hear that and see that and have the validation that this was meaningful work for ARCH to do. Then lastly, as you're posting your one key takeaway, if we go to the next slide, I want to call your attention to our feedback survey. And those of you who do survey research know that usually we get 20% of feedback on surveys. We want to get 100%. We would love for everyone to please take just a few minutes to take the feedback survey. It's short, it's sweet. We really value that. It's so important for us to show the funders that this was valuable. So please, right now, take a few minutes before you end your day. We'll let you out a few minutes early so you can finish and complete that evaluation survey. We'll pop the link to that in the chat as well for those of you who struggle with QR codes, because I know sometimes they don't always work for me either. And this will also come out in the follow-up email as well, so you'll have an opportunity to see that link, but it's often easiest to do right away while it's top of your mind. So encourage you to please take the feedback survey. And then if you go to the next slide, Marcia, I believe this is our last one. Just again, a resounding thank you to all of you for participating today. A reminder that all of these have been recorded and are going to be edited and put up onto the ARCH website for you to be able to rewatch certain presentations that you may have missed or you want to hear again. All of the slide decks from all the presenters are also on the website, so we encourage you to review those resources and reach back out if you have additional thoughts, questions, or there's ideas that you have on how we can continue to work together moving forward. I'm grateful for this time that we've shared over the last 3 days. I'm honored to be a part of this important work, and I'm so thankful for such an incredible summit and great presentations from all of my colleagues. And again, I'll leave the last word to Jill to give her final thank you before we close out the day.
Thank you, Kim. My biggest thanks go to Kim, because she is the grand facilitator and is so adept at this, but not just her facilitation skills, her incredible knowledge of respite, her compassion and passion for respite, and her knowledge about research has just been a tremendous asset to the work that we're able to do at ARCH. So thank you, Kim, for leading an incredible 3 days. It really was an incredible 3 days. I'm getting so many comments, not only in the chat, but on email too. So again, thank you to all our presenters, especially Kadijha, all the way from Tunisia today. That really impressed me that she was willing to present from such a distant place. And again, I don't even know how to begin to thank all of you, but thank you all for joining us. And in the next couple of weeks, we'll post the links to the recordings of these events. If you want to listen again or share with your colleagues, please do. And again, everything is available on the ARCH website, and we hope you'll join us for future events as well.